Good afternoon, everyone, and welcome to this webinar co-organized by the Federation of Veterinarians in Europe and the EMA uh, for veterinary healthcare professionals. And today's topic is going to be on data collection on use and sales data for antimicrobials in animals in the European Union. My name is Barbara Freischem. I'm a veterinarian by training. But currently, I'm heading the Department of Surveillance and Regulatory Support in the veterinary division of the European Medicines Agency. In this capacity, I am looking after all surveillance activities that would include pharmacovigilance, but also data collection on use of antimicrobials. And any regulatory topic and support that is necessary and then related to our centrally authorized products. It's my pleasure to co-chair this meeting with Rens van Dobbenberg, President of the Federation of Veterinarians in Europe. This is the third in a series of webinars jointly organized by EMA and FVE. Really to raise the awareness amongst healthcare professionals on key topics related to the implementation of the veterinary medicines regulation EU 2019-6, which will govern how we authorize veterinary medicines in the future, but also additional topics that relate to how we use veterinary medicines in Europe going forward. This regulation enters into effect on 28th of January next year, so very, very soon. And among the key goals of that regulation is also to strengthen how we in Europe address antimicrobial resistance in a One Health approach. And part of that is really moving some of the very successful voluntary activities that we have undertaken with your support and with the support of the farmers in Europe into legally mandated ones. And it sounds a bit like the stick is coming after the carrot. But sometimes putting it into legislation is also necessary to ensure long-term funding. So I don't see that really as a bad thing. I actually see it as a testament to the great success of the progress we've made over the past years. And if you want to know more about that, just look at the SVAC report that was published yesterday, covering the data for 2019 and 2020, which really shows how hard you are working on reducing use of antimicrobials in animals. So today, in our webinar, you will hear on the collection of volumes of sales and use of antimicrobials in Europe and its implications for you as animal health professionals. You will hear presentations from national competent authorities, but also veterinarians. And then there will be a large section where you will be able to ask questions to a mixed panel representing regulators, veterinarians, and also the EMA. And, why are we co-hosting this event as at the EMA? It's because we continue to have a key role in the collection of antimicrobial sales and use data. Member states need to report annual data to us, and we as an agency are charged with publishing annual reports. But again, all goes back to your work in the field, dealing with the diseases that you see in your daily life. So, right, I think this event will be an opportunity to learn from the experience in the member states to date in setting up systems for data collection, and we really must differentiate between sales and use data. Sales data we can get from marketing authorization holders and other organizations. Use data are much closer to your daily work, and in many countries will probably also involve you. So I hope it's going to be an interesting experience for you. And before I hand over to Rens for his introductory remarks, just a few housekeeping sessions. I would like to urge all presenters to stick very closely to the timing. We do want to focus on the question and answer session at the end of this meeting today. And you have a lot of information to present. So please help me in keeping this webinar on track timing-wise. And if we can't take all questions today, you can always reach us at the functional mailbox, which is vetchange.program@ema.europa.eu. And please be reminded today's webinar is recorded for training purposes, and it will be made available on the agency's website in the upcoming weeks. By continuing to stay connected to this session, you consent to being recorded. But of course, your personal data will be processed by the EMA in accordance with regulation EU 2018/1725, the General Data Protection Regulation. If you don't agree to that, I have to ask you kindly to leave this meeting, but I trust you're all confident and okay with being recorded. And with that, I would like to hand over to Rens for his introductory remarks. Rens, the floor is yours.
Thank you very much, Barbara. Dear colleagues, a pleasure also for me on behalf of FVE, the Federation of Veterinarians of Europe, to welcome you at this webinar, where we will discuss the collection of sales and user data of antimicrobials in animals. FVE and EMA, European Medicines Agency, cooperate in organizing this webinar, being, as Barbara already stated, the third in a row now. The previous ones focused on the AMAC categorization of antibiotics and on pharmacovigilance. And FVE likes to thank EMA for the opportunity here to work shoulder to shoulder on what is our work, supporting the vets in optimizing veterinary medicine. The aim of keeping these webinars is to inform and discuss with our colleagues in the field, mostly veterinarians, but not all, the implications of coming into force of the NVR January 2022. Although the text of the regulation regarding the topic is quite clear, EU member states should collect, besides the sales data, also the user data, specified per animal species, and put in a time frame for the coming years to start when with which species. Despite that, a lot of practical questions is still to be answered. Establishing such a system of collecting user data is totally different and needs more preparation than the system we used so far, providing SVAC with national sales data. And of course, sales and user data are different. Due to, for example, storage or other reasons, the numbers will not be alike. Some countries are running systems for collecting user data already for quite a few years, and others have to start such a system from scratch on. We like to encourage all of you to connect to countries already running such systems in order to exchange best practices. Be also aware, in not all countries, these are public systems. Sometimes initiators were from the work field itself, veterinarians, farmers, pharmaceutical industry, mostly pushed by the supply chain directors like milk factories and meat processing industry taking the lead. Setting up this system creates a lot of questions. Who to create the system? Financed by whom? Will it increase the administrative burden for vets? And if so, who will pay for that? Who can look into my data? Are the data mine or the farmers? Who takes care for calculating daily dosages and who will establish thresholds, if any? If a vet or a farmer does not comply with the system or are continuously in the red area, what will be the ultimate sanction? Lots of questions which we'll try to address here today. To do so, we invited 3 excellent speakers and 4 panel members, all experts in the field, like a lot of you in the audience. Sharing information is what we are together for here today. So don't hesitate to ask questions. Hope you will enjoy and it helps you give a better understanding of the new legislation. Thank you. Back to Barbara.
Thank you very much, Rens. And without further ado, I would like to introduce the first speaker for today, Claire Chauvin. Claire is a veterinarian with a master's degree and a PhD in pharmacoepidemiology. And she joined the French Agency for Food, Environmental and Occupational Health and Safety, ANSES, in 1999. Claire has over 20 years experience in data collection on the use of antimicrobial and its impact on public health. She participates in EMA expert groups related to SFAC, the current system for collecting sales data, and JIACRA, haven't mentioned that today yet, the joint interagency reports between EFSA, ECDC, and EMA on correlation between antimicrobial use in animals and humans and the emergence of resistance. Claire will present the data collection on sales and use data for antimicrobials in France, its history and future. So Claire, the floor is yours.
Thank you very much, Barbara. I hope you can hear me clearly. I will begin. Next slide, please. Yes, I would like to begin with some background and context elements I think are important. The surveillance systems was firstly implemented in France in 1998 through a surveillance and research program funded by the Ministry of Agriculture. The first report on sales was covering the 1999 data, and on-farm studies on use were regularly implemented during a 10-year period. Until next slide, please. Okay, thanks a lot. The methods on collection of on-farm data was progressively transferred to the interprofessional bodies and technical institutes, firstly in pig production, then in rabbits, villicards, and poultry. Next slide. This was favored by the 2 national plans called Eco-Antibio, aiming at helping the professionals to reduce the antimicrobial use in veterinary medicine through a set of different measures with one objective, clearly stated, to provide veterinarians and farmers with tools for self-evaluation of antibiotic prescription and use. Next slide, please. In 2014, a law was adopted called Law for the Future, and the transmission on data on antimicrobial sales and use became mandatory. As a result, in 2018, a first report was published on the data collected from feed mills. Now we are in 2021 and the future is tomorrow. Next slide, please. With the new regulation already mentioned during the introduction and the next step, which are the transmission of data on the different species. Next slide, please. Just a few words on this regulation and the specification regarding data collection. As already said, the new regulation provides a legal framework and it extends the scope to other antimicrobials. There is also a clear requirement for member states to develop semi or fully automated continuous collection systems, establishing clear timelines as shown here. And there is also a requirement for data quality management. Next slide, please. Going back to the French system, next slide. I will not have time to develop all the different characteristics of the systems on use data, but I would like to illustrate the outcomes and the uses made of the different results and data. First, the data on sales are available since 1999, so it's very useful to look at the trends and achievements. Now it's a process under quality assurance. And as you can see, we can get some data on all animals, but also per species estimates. Next slide, please. Considering the complementary detailed information gathered from the different professional collection systems, I would like to illustrate how they were used by professionals. First, for example, they were used to gain a better knowledge of practices to inform decision. For example, from the first on-farm pig surveys, it was clear that sometimes cephalosporins were used in some farm in a preventive systematic purpose. Therefore, voluntarily, the professionals committed a consensus to withdraw cephalosporins, with a great success, as you can see. In rabbit production, for example, it was due to have a better understanding of the different trajectories because a plan was decided and adopted by the professional sector to reduce antimicrobials, and a few years later, results were quite heterogeneous. It was therefore decided to have a look into the data and to try to identify a cluster, you can see here in yellow, of farms experiencing difficulties in reducing. And therefore, characteristics were checked, and the training and coaching could be adapted to these farms and their characteristics with a greater success in the next years. Lastly, for example, in poultry production, the different production operators frequently have their own data collection system, but they decided to put together their results to have quarterly estimates at the national level to be able to compare their own results. Next slide, please. Lastly, from the deliveries from feed mills, you can see that now we can have some quarterly results, allowing us to study the heterogeneity on a geographical or time point of view and also between species. Next slide, please. To sum up, we have already different data collection systems on use of antimicrobials, and they were set up considering professional requirements, constraints, and objectives. But now, the new European regulation requirements are not fulfilled by all these systems, mainly due to limited coverage through sample or regular data collection, not continuous one, or because of missing data. For example, in rabbit production, it's a quantitative measurement, but no information is available on the compound used. Next slide, please. As a result, we need to set up and conceive before a new data collection system. And just to give you some elements, here are the effectives of the different professionals and the different people that can be involved. As you can see, we have 3 professions that can deliver antimicrobials: veterinarians, of course, pharmacists, and feed mills. For this last one, a data collection system is already okay. But all the deliveries can be made towards a large number of farms. Next slide, please. Therefore, we will move to the future now. Next slide. And the future is called Calypso. It's the name of an information system, including other data transmission and consolidation tools. It was conceived in a broader view of the veterinarian's activities in the veterinary public health framework. But clearly, the priority business process is on data collection on use of antimicrobials. It's discussed since the Law for the Future, adopted in 2014. It's prepared since 2017, and it's now managed by the French Veterinary Council with an official mandate from the French Ministry of Agriculture. The system is based on deliveries and prescription data collection from software and practice management systems already in use in veterinary practices. It will cover and consider all species together, but with priorities in line with the calendar exposed. And it will focus, in addition to the national aggregated data transmission to the European agency, it will focus on individual reporting for self-evaluation purpose and follow-up improvement. Next slide, please. Here is just the architecture of the system, where you can see the 3 different professionals that can input and produce some data for the data collection, the veterinarians, pharmacists, and feed mills. It will be administered by the Veterinary Council, the Ministry of Agriculture, and the National Agency. And relationships will be established with databases on human and veterinary medicines and also on animal population data. Next slide, please. Just to conclude, I would have a short focus on the strengths and the weakness of the system we plan to implement in France. The key persons are clearly the veterinarians involved even in the management of the system. There is a clear and shared workload limitation objective. We have strong previous experience and knowledge of use data in France. Therefore, the usefulness of this kind of data is clearly recognized. There is an addition to the self-evaluation objective already tested, and it's part of a global information system, not only a system collecting data on antimicrobial use. On the other side, we have numerous sectors and various cases to consider. The regulation has to be adapted with adoption of new texts. Clearly, there is a topic on the budget required for such a system, and there is a time constraint to consider with the calendar. Therefore, I would say that it's clearly a challenge for veterinarians and national authorities. And to conclude, it's a work in progress, and I would be pleased to present you in a few years the results. Thank you very much.
Thank you very much, Claire, for that very interesting presentation on the system in France. As I mentioned before, questions will come at the end of the session, so I suggest I hand over to our next speaker, Laura Mee Jensen. Laura is an animal scientist and whose daily responsibility is for the Danish database collecting veterinary use data, which resides within the Danish Veterinary and Food Administration. Laura is also the SVAC national contact point, as well as a member of the SVAC sales advisory expert group. She's also the OAE contact for antimicrobial cells and use data, and most importantly for today's presentation, a member of what we call the ASU project group, meaning the group of experts in the member states that help us transition from a system that collects sales data only to a system that also collects use data. And Laura will present on collecting use data with Denmark as an example and update you on the ASU project. So Laura, the floor is yours. Thank you.
Yes, thank you. Next slide, please. My presentation today will, as just mentioned, be split into two. First, I will try to give you a very, very short presentation to the Danish tool. And finally, I will try to give you an even shorter presentation of the updates on the work going on in the ASU project. Next, please. To understand a little bit where Denmark is today, it is necessary to understand a little bit about where and when we started. Vetstat is the name of the Danish database, and we have collected data since 2000. We have used the collected data as sales data in the context of SVAC for now, but as soon as the VMP go into force, we will classify the data as use data. We have just modified the system to collect data on herd level, and we will be collecting use data for all animal species in accordance with the stepwise approach. Next, please. Vetstat collects use data for all veterinary medicines, not only antimicrobials, but the figures presented here in this presentation is antimicrobial only. Vetstat collects prescription data from pharmacies and from feed mills. 98% of all antimicrobials are distributed from the pharmacy and 2% from the feed mills. 94% of the pharmacy distributed antimicrobials goes directly to the farmer. 6% goes to the veterinarian for use in practice. Next, please. That means that all data collected from the pharmacy is useful in VetStat without further work. The antimicrobials distributed to the veterinarian for use in practice has to be reported by the veterinarian into VetStat. The veterinarian has to report information about the medicinal product, the herd where it's used, and the disease. Next, please. There are two methods for the veterinarians to report into VetStat. The first method is directly through the user surface, where the veterinarian can either type in the record or put the data into a template and upload it. The second method is through the veterinarian practice management system. This is where the data is collected either through the billing system or by the logbook system. These data are sent through the farmer's organization, but that is just a technical way to try and reuse data. So there is, of course, some extra work in accordance with data collection, but we do really try to reuse as much data as possible. Next, please. When we collect all these data, we are, of course, also obligated to put them into use. We present the data to the farmers as well as to the veterinarians, and we do expect that the veterinarian include this knowledge in his supervision on the farm. For pigs and cattle, we have developed benchmarking systems where all farmers can see his own average use up against the national average. For pigs, we have also introduced a yellow card initiative where farmers are benchmarked up against a threshold value. If the average use on the farm for a specific age group crosses the threshold, the farmer gets a yellow card. The yellow card demands that the use of antimicrobials on the farm is reduced to below the threshold. But the main objective of the yellow card initiative and benchmarking in general in Denmark is to give the veterinarians and the farmers a tool to include antimicrobial use in the discussion of other aspects of the production which affect the general health on the farm. Next, please. On the national level, we use the collected data for reports. DanMap, which actually came out last week, is our yearly report produced by the Danish Technical University. This is our window to the public. This is where we try to report and interpret data concerning antimicrobial use and resistance in human as well as in animals. DanMap has existed for 25 years, and it is here we present our joint effort for reducing antimicrobial use and the effect it has on resistance. This report is the frame of reference in Denmark, and it is used for both farmers' organizations, the veterinarian, the public, and the political level. Next, please. On the international scene, we report antimicrobial use into both the ESVAC and the OIE reports. These reports are used to place Denmark on the map. We are a food-producing country, producing more than 30 million pigs a year, and the results in the yearly ESVAC report is part of the information used to set goals in Denmark. Both our national and international appearance in this field is what gives the Danish farmers license to produce. Both farmers and veterinarians in Denmark know that producing and selling meat nationally and internationally is based on the brand of the product. And collecting, using, and presenting antimicrobial use data has been an advantage for the Danish farmers, branding Denmark as a country with low use. Next, please. This was a very short presentation of how we use antimicrobial use data in Denmark. So now I will switch to give you a very short presentation on the work going on in the ASU project. Next, please. The ASU group and the work done here arises from the VMP and the wish for collecting sales and use data described in Article 57. This article describes that it becomes mandatory for all countries to collect sales and use data, that the member states become obligated to report these data into EMA, and that EMA will have to analyze and publish these data. Next, please. To be able to collect, maintain, and analyze all these data from the member states, EMA has been obligated to develop a database. This database is where the member states shall deliver sales and use data, as well as animal population data, where the data quality is ensured and where the member states can correct data if mistakes are found. Next, please. The system overview looks like this. This is where member states will submit data in a standardized format, where quality is ensured and where data analysis and reports are made available for the member states and for the public in a standardized way. The work in the ASU group has just shifted from the period where we have described the business requirements to starting up the design and architecture development. The hope is that we get the first go live in fourth quarter of 2022, so that we can train and be ready for reporting in 2024. Next, please. Finally, I wanted to do a little commercial for the VMP newsletter. Here it is possible to follow the progress of many of the activities going on in the connection to the VMP. And that was actually what I have prepared for this presentation, and it was sharp on 9 minutes. So thank you for me.
Fantastic. Thank you very much, Laura. I was getting worried along the way, but you did admirably, and I won't prolong and hand over the floor to Giovanni Guadagnini. Sorry if I mangled your name. Giovanni is a veterinarian who graduated from Parma University, and he is our practitioner today, and I'm really interested in hearing your view on benefits and challenges of antimicrobial data collection. Giovanni is also president of the European Association of Porcine Health Management and vice president of the Union of European Veterinary Practitioners. Thank you very much for talking to us on this topic, and straight over to you for the presentation. Thank you.
Thank you very much. Good afternoon to everyone. Next, please. Let me introduce FVE, the Federation of Veterinarians of Europe. The FVE represents more than 300,000 veterinarians, 47 national associations, 39 European countries, and it has also 4 sections, one related to practitioners, one for hygienists and public health officers, one for veterinary state officers, and one related to education, research, and industry. European veterinary profession enhance animal health, welfare, public health, and protect the environment by promoting the veterinary profession. And FVE supports all veterinarians in delivering their professional responsibility to the best possible standard and ensure that veterinary expertise is recognized and evaluated by society. Next, please. We are talking about the European law on veterinary medicines, and what is new on this topic is that on farm monitoring system of antibiotic use and national surveillance of antibiotic use become mandatory. So we need to provide data for pigs, poultry, and veal calf for 2024, and data for all food producing animals for 2027, and for all animals, including pets, for 2030. So we need to start to collect the data to have the possibility to send all this data. And also the advertising veterinary prescription medicines in the lay press will be forbidden. But in some member states, the advertisement of some vaccines can be allowed for farmers. Next one, please. Till now, we have used antimicrobial sales data to consider the situation, but in several member states, we don't have a real clear situation. So we have sales data not provide any information about its actual use. So more than one product can be used for several species, and also we don't have all the indication how, when, where, by whom. So we have data, but we need to go in deep. Next, please. So the benefit of antimicrobial use data collection is the possibility to differentiate the antibiotic use by species. And this is really important to have a clear situation. And also the identification of a temporary association between antimicrobial use and antimicrobial resistance. So we can connect the different use of antibiotics with the resistance that we can find in field. And also we are working a lot on best practice and to give advice to the farmers, but we need also to connect it with the data. So the evaluation of specific policies that target the goal of reducing AMR is very important. Next, please. But we have also a lot of challenges related to the antimicrobial use data collection because we have a lack of consensual and harmonized technical methods and units that represent antimicrobial use. We have insufficient incentives to motivate primary producers to report their use of antibiotics, and there is an existence of user-friendly technologies for the collection of this data. So antimicrobial use data system require important investment on country level. And we know that there are several countries that are working hard on this, but others that have problem to collect this data in deep. Next one, please. If we need to collect the data, but we have also not overburdening competent authorities, farmers, and vets, and also without additional bureaucracy and cost for vets and also farmers. So the responsibilities need to be really clearly defined, but it happens that some mistake can happen, and so honest mistakes not be penalized. Next, please. Let me introduce the experience of Italy and my practical experience. In 2019, the electronic prescription started, and we have a prescription that is in a public system created from the Italian Ministry of Health, and you can see on the top on the right, is called VetInfo, and in VetInfo you can find several things like all the population and all the data of official controls, but also all the data related to the prescription. And from the 28th of January of next year, 2022, every treatment will be electronic, and this is mandatory. So all the system is already active and it's ready, and we will reach the target related to track the drug use in farms and also for companion animals, because all the electronic prescription included all the vet's prescription. So all the data will be available, and all data could and should be analyzed. Next, please. When we open the system for prescription, and every vet needs to prescribe, so you can see on the left what we can see entering, and on the right it is all the what was used in this farm. I choose one example. Next, please, with the red line. And here, when you open, you can see the name of the product, the format of the product, the animal in the third line the animal that are treatment, the number, the species, the sex of the animals, and also the diagnosis related to the pathology that is treated, and also the route of the administration of this. So we have a lot of data, but you need to collect all this data and then to analyze, because it's a huge amount of data. It's not easy to understand looking only this system. Next, please. So the system called the Classifarm was created. It's included in the same box where you can find all the animals and all the data related to the drug. And opening Classifarm, I can show you some farms, some of my farms. Next, please. First of all, we have two different steps, because the analysis of antibiotic use into the farm, it's in the first step, all the antibiotic amount used into the farm is related to all the population present into the farm. So disease is called DDD of biomass. Then in the future, after the all electronic treatment, we'll have all the details related to that. So all the amount will be differentiated in categories. So for example, for pigs, we will have piglets, weaners, fattening pigs, and then sow gills and boars. So I will show you some farm with the biomass analysis, and then an example with categories, and then an example of all the amount related to my farms. Next, please. This is what you can see if you open this farm. I choose my farm, and you can see down on the left, the light blue column. Here you have the amount of use in DDD for 2019, 2020, 2021. And if you look the yellow line, that is the median of the whole nation. So you very quickly can compare the amount of using of your farm with the using of the median of all the nation. In the center, in the middle, you can see the first line that is yellow. You can read 106. This is the comparison with the national data. And the second one is related to the region where the farm is located. And the third is related to the province that is also for the veterinary office that is organized in the area of the province. Down in the middle, you can see all the different products that we used in this farm. So you can see the first that is amoxicillin with 3.2 DDD. The second is doxycycline for 3.1, and this is the data of the 2020, because I choose to show you 2020 because it's finished. The color of the column is blue, because amoxicillin and doxycycline are not critical products. Then you can see the fourth that is yellow, and is tulathromycin. It's a macrolide, and so it's precritic. It's considered precritic and is yellow. And you cannot see anything red, and red are the critical products that are third and fourth cephalosporins, colistin, fluoroquinolones, and quinolones. On the right, you can see that the route of the administration of the products. So you can see premix that need to produce the medicated feeds. And in this farm, that is a farrow to finish, we have 13% that is related to feed medication. Then the light blue, it's oral powder, and it's oral medication, but not in feed, so in water. And we have also the third part that is injectable product that is 13.6. Next one is another, thank you, is another example related to a farm that is a farrow to weaning. So only with sows and piglets into the farrowing unit. Here you can see the light blue column that underline the use that we have in this farm in 2019, 20, and 21. And here you can see in the middle down all the antibiotic that we use, and here you can see that tulathromycin is a little bit more than before. I would like to underline that the use of the oil products is injectable, because down on the right you can see that 100% is blue and is related all to injectable products. This is as data of 2020. Next, please. This is a fattening unit, so now the system is always the same. I don't need to describe you, but the column is that you see that in 19 was 0 because it's a new farm and it wasn't producing animals in 2019, so it's 0. But in 2020 we had 9.81 DDDA related to the median that was 7. And in 2021, we are now around 3, and the median is 4.53. Also here, looking in the middle, you can see that in 2020, the use of antibiotics was higher than the median, so it's 140% related to the whole nation. But if you look the region and if you work the area of the veterinary office, we are not so high. And down on the right, you can see the route of the administration, and we can see that the most is oral powder, so in the water, and we have 11.5 of injectable products. Next one, please. Here, another example related to the fattening unit that had a problem in 2021. You can see as in 2019, we were around 3.3, so less than the median, and also in 2020, we were around 4. So it was a farm with a low use of antibiotics, but this is the data of 2021. And here we can see that we passed from 4 to 31 DDDA, so a huge amount of antibiotics related to an entering problem by Brachyspira hypodysenteria and Lawsonia intracellularis. So here you can see down in the middle that a lot of tylosin and lincomycin was used, and also in looking the route of the administration, the most was for oral powder and oral solution, but also feed medication was used for the 30% of the products. Next, please. I would like to show you a case with the categories. So I choose the winners because it's the most difficult category to manage. And here you can see it's a little bit different because down on the left you have the different years of use. So you have 2015, 2016, 17, 18, 19. This data will be automatic, but now we put all this data manually, taking from the paper, analyzing that, controlling that again, and putting into the system. So we stopped to 2019 when the automatic system started. We were around 274 DDDA, so a very huge amount of antibiotic. And if you look down in the middle, you can see that 222 are related to feed medication, and few are related to oral solution or oral powder, and only 1% is related to injectable product. So you can see that the most of the activity with antibiotic was done by feed medication. Looking the different product that we use, that is in the middle on the right, you can see that we have doxycycline as before, amoxicillin, thiamolene, but look, there is a very huge amount of colistin, that is the orange one, and here we're still using a lot of colistin in feed. Then we started to work a lot with different vaccination, with different management, stopping to use colistin and so on. So next one, please. This is the situation of 2019 in the winners. And so in 2019, we had 70 DDA, so we reduced around 200 DDA. And you can see that we don't have any colistin. If we look in the middle on the right, there are different colors, but colistin is not present. In the middle down, we have oral powder, premix, and oral solution, but we have a very less use of feed medication. We passed from 80% to 21% of feed medication, and we switched to more oral by water and with more injectable product that passed from 1% to 4.6%. You can also see in the middle the comparison with the median. We are lower than the median of the nation, but also lower than the region and the area of the veterinary office. So this is what it could be done with data, and this shows you clearly the work that we did in a few years. Next, please. This is my farm biomass. So I'm located in the north, in Lombardy. So it's the red area because it's the area with the most of the animals. And you can see in the middle, 2019, it was 23.97. And it was, as a vet, a little bit higher than the median that was 20.7. So I was not using critical antibiotics. If you look in the middle down, you can see a circle that is for the most blue, because the 95% are related to not critical products, and only 4.3 was related to macrolides that are precritical. Look the premix on the middle, on the right. The premix for feed medication were 47% and oral powder 41%. Please, next. This is the situation of 2021. For this year, we are still located in the red area because it's the area with the most of the animals, and so with the most use of antibiotics. You can see that my number, my DDA, is 19.83, and in 2020 was 21. So I decrease of 2 DDD for every year. And now I'm very close to the median of the nation, because the median is 19.81. So I am very, very close to the median, and I used less antibiotics than 2 years before. The situation related to the products is more or less similar to 2019. You can see down that 94.2% was not critical and only 5% of pre-critical. But I would like also to show you that the most is related to oral powder and not to feed medication. So in 2021, we used only 20% of feed medication. You can see this on the right in the middle, that premix are 20%. So we passed from 47 to 20. And this is the way to decrease the total amount, because it's very important to lower the feed medication. You can also see, if you look down on the right, that there aren't any red products. So we are very happy not to need to use colistin or fluoroquinolones or quinolones or cephalosporins. Next, please. To conclude, data are very important to understand the real farm situation. We started to push the farmers, explaining them that we could lower the amount of money they need to put into the farm. But this worked very good at the beginning, but not after, because you need an amount of money to introduce the vaccines, and you do the vaccines to prevent the diseases. So that expenses is always present. So at the beginning, we pushed the farmers, but because we didn't have the data, and used the motivation of money. But the data are very important for the vets because the data can drive your work and can help you to understand where you are going. It's important for the farmers because when you could show what is doing his effort, is very motivated to go on. If you cannot show them, it's always, but before I did something different and it works. But if you have data, they are very proud of this data and can go on to do a lot of effort to use less antibiotics. It's also very important from my point of view for consumers, because in the future, all the products that we produce will be related to the use of antibiotics, because when you produce a number, you can use not only for the pigs, for the farm, for the vet, but also for products. And AMR need to be fight with science and not with feelings. And we saw this also a few months ago. Next, please. When FVE worked a lot and did a lot of effort to push the European Parliament for taking One Health approach and voting for science-based regulation in Europe. FVE is very motivated to go on to help the vets to understand how they can work and to support all our efforts. And with the next one, I would like to thank you. Thank you all very much.
Thank you very much, Giovanni, for your take on what you can do with the collection of data on antimicrobial sales and use. Really, really important. And as we prepare for reporting the national data, I think I'd like to take some pointers from your presentation on how we can make our reporting also relevant for the practitioner. So thank you very much for that. I would like to hand over to Rens for the question and answer session together with a number of panelists, but also there were a few questions directed at the speakers that Rens will hopefully also take. So over to you, Rens, and your team of panelists. Thank you.
Thank you very much, Barbara. Dear colleagues, our speakers you have already met, and besides them, we also have some expert colleagues in the panel, and I'd like to introduce them to you, followed by a 1-minute statement of each of them. First colleague to start with is Gregory Schoonbrood. He's a large animal practitioner since 2003 in Belgium and Luxembourg, speaks a lot of languages, including even Dutch. Also teaching practical courses to veterinary students at Liège University. He's currently the chairman of the large animal practitioners section at the Belgian Walloon Veterinary Association, UPV, Union Professionnelle Vétérinaire. He also represents Belgian practitioners in UEVP, the European Practitioners Organization, and FVE, the umbrella organization, in their general assemblies. Gregory is a prominent European leading vet as a practitioner working in the center of the vet community. And I'd like to ask him for his 1-minute statement, Gregory.
Well, thank you very much, friends. I would like also to thank the speakers till now that were very interesting presentations. Just to give a little feedback of the practitioners in Belgium, we, as a veterinary association, we participated actively in the development of a database that has the same destiny, meaning to collect the use of antimicrobials. Not initiated by the national authorities by that time, but actually by the supply chain actors, more specifically the milk industry in this case. So we were actually participating because we were willing to get also some advantages out of the pure encoding of the data. And that was also promised by the developers that we would, of course, in a second time shift get some tools to be able to use the information, because the encoding is very precise, giving the specific age of the animal, the diagnosis, and it also takes more than just antibiotics. It takes all the medications. So the meaning was indeed to have at the end of a year a tool in the hand, probably presented like the diagrams that Giovanni showed, about more the specific location of the problem and the diagnosis. Just to say briefly, we intended specifically to make it doable, feasible for us veterinarians. Our big motto was only once, meaning that for most of us, we work with the software now at the clinics. So when we encode our visit with the medication and so on, we would like this to be the only act that we have to do in this matter, meaning that the software is supposed to send this information further, and this is actually working not so bad, but there's a lot of problems still, technical problems. They have to speak the same languages, different databases, and that's probably one of the big issues there. Okay, thanks. It was more than a minute, sorry.
Thank you, Gregory. Next colleague is Hetty Scheurs. Hetty graduated from the Faculty of Veterinary Medicine in Utrecht at 1988. In 1996, she completed her PhD. She worked until July 12 at the Faculty of Veterinary Medicine in Utrecht, at the Animal Health Service in Deventer, and in a veterinary practice near Utrecht. Since July 2012, she is Managing Director of the Netherlands Veterinary Medicine Institute. As such, Hetty was first role involved in the establishing of the current Dutch system for collecting user data. Hetty further has an affiliation at Wageningen Bioveterinary Research as well. And last but not least, she and I know each other since vet school, which is an incredibly long time ago. Hetty, do you want to make your one minute statement?
Thanks, Rens, for this kind words. Being manager director of a veterinary institute in the Netherlands, we depend on data. So my statement is about data, not only to tell you how important these are when you would like to calculate something, but more for the farmer to have them, because having this data about antimicrobial use, that will be the start of having a discussion what they can do to improve. And not only for the farmer, but for the vet as well. We have data of the prescription behavior of the vets in the Netherlands. And as soon as when you talk about these prescription behaviors and could share this information amongst them and could say, what can I do to improve my prescriptions on these farms in order to lower the antimicrobial resistance, that will be very helpful. We do have this data at farm level, at sector level, and at national level as well. And having this data at sector level did help us to show and to demonstrate that lowering the use of antimicrobials in a specific sector was associated with lowering the level of antimicrobial resistance. And I think that having antimicrobials in the future is the most thing where we all would like to work on, and that we would like to take care of using them now for preventing having too much problem seeing this resistance at farm level. Thank you, Rens.
Thank you. So fighting resistance is what counts. Thank you for that statement. Then we go over to Katarina Kivilahti-Mentile. I hope I pronounced well. Katarina is a veterinary officer at the Finnish Medicine Agency. She's involved in monitoring of sales of veterinary antibiotics since 2007 already. She's a member of SVAC, especially the sales EAG. I'm not sure what that's the abbreviation of, and the SVAC National Contact for Finland. Other areas of her expertise are safety and efficacy of pharmaceutical veterinary medicinal products, with a focus on the food-producing animals and residues and antibiotics. Katrina, also I would like to ask to make a 1 minute statement.
Thank you. And the name was correct, and the EAG goes for Expert Advisory Group. Thank you very much, and thank you for the excellent and thorough presentation. I think it's impressive what has already been done in these countries. And like you mentioned, I've been with the SVAC since the beginning, and just yesterday we got a new report, and it's really impressive how much the sales have already been decreased, aggregated overall sales within the decade. And also we have seen the decreasing the sales of antibiotics classified as critically important in treatment of humans, and those have both been the goals already, and now when we need to get further to fulfill the farm to fork strategy aims, I think the use data is the only way forward. And like Heti already mentioned, with the decrease in use, we see also decrease in the antimicrobial resistance. I fully understand the concerns about extra work and expenses. And I believe also that the people who are developing the systems, data collection systems, are doing their very best to make the systems as user-friendly as possible. And like Giovanni has also said that by understanding how the antimicrobials are used in the farms, we can identify the best practices. And I think in the long run, we can really reach the goal to preserve the efficacy of the antibiotics. Thank you.
Thank you, Katarina. So in summary, we are on the right track, but we need to refine, and we have to trust that the practical hurdles will be addressed. Thank you very much. Over to our last panel member, Lucy Pokludova. Lucy is a microbiologist, assessor of efficacy of antimicrobials at the Institute for State Control of Veterinary Biologicals and Medicines in the Czech Republic. Lucy is also a part-time university teacher. She represents the Institute of State Control of Veterinary Biologicals and Medicines and the Czech Republic on global and European fora related to antimicrobials. She is part of the coordinating team of the One Health Czech National Action Plan on AMR. In January 21, Lucy published with co-authors the first volume of the book Antimicrobials in Livestock, Regulation, Science and Practice. Lucy already goes a long time back with FV. Together with Nancy, our executive director, she published on the topic of antimicrobial use more than once. And also you, Lucy, I'd like to ask for your statement.
Thank you very much, Rens, and also my sincere greetings from the Czech Republic. I would like also thank very much to previous presenters for their excellent and perfect presentation and sharing their practices and experiences, because I think it's one of a piece of important thing to share our views, experiences, and tools we already have available for the data collection. What I would like to highlight is that we are doing all this data collection not only to filling European statistics. I have to say, when I've spoken to the farmers and veterinarians in Czechia, that this is about to gaining the data for our own farms. This is about a very close cooperation of veterinarians together with farmers. And also, I would like to mention that we need to gain some user-friendly softwares and applications for the vets and farmers to fill their duties with respect to collect the data on use of antimicrobials. I also recognize, and it was probably touched by previous speakers, that we urgently need some tools how to return the vet, would they, let's say, use their effort, their time, and we need to establish some powerful way of communication and also to somehow sell the data about use of antimicrobials towards consumer, towards human medicine, and show that veterinarians and farmers pay a lot of effort to improve the situation in the veterinary medicine. And last but not least, I would like also to mention what was said by Giovanni, and I like it very much, that finally, when we succeed, we will be very proud of the achievement. More healthy animals, more responsible use of antimicrobials, and less selection pressure on antimicrobial resistance. Thank you very much.
Great, thank you. So if I may summarize, something like not only rules, but also should have practical effect. That's an important. Thanks a lot. Okay, then it's time to go over to the audience and to invite you to the floor. If somebody wants to ask a question, please use the yellow hand. While waiting for that, I should see people who do that, but it's still empty. But we already received some questions. For example, there's a question to Laura, whether the Danish system also applies to pet animals.
Well, yes. Every prescription medicine is collected into the VetStat database based on prescription for now. In the moment, veterinarians are not obligated to report use for pet animals, but in relation to the VMP and the stepwise approach, they will be obligated to report use in practice for pet animals into VetStat. Yes.
Thank you. So it's included. A question for Giovanni Battista about how is the prescription entered into the Italian system? Are there other ways than the website? Are there independent apps available? That's a good one. That's a good question. Giovanni.
Every prescription is done into the system. The system is online, and you can use the PC connecting to the website, or you can use also an app, and you can prescribe all what you prefer, medicated feed or different products, and you can then send to the system. You receive a number of the prescription and the code, so only you as a vet and only who has the code can see what is prescribed, so could enter in the prescription. And you can use also the system offline and then send when you have the net. So it's quite easy to use. At the beginning it was not so easy, but now we feel comfortable to prescribe. And also for small animal, for pets, now there is also a communication with the clinic's management tool, so you can use your system, and the system, the most of the systems speaks with the national system, and you can do the prescription from your system and then receive the number from the national system.
Thank you. An additional question for you, Giovanni, from Kari. How do you assess in Italy if the veterinarians report all use? So how can we assure everything is reported? In a brief answer, please.
Sorry, I didn't understand.
Is it possible to check for authority if all the use has been reported? How can you see that?
But the system is national system, so the official vet can see what you are using, but only that the people that can control you, and all the data go into the system because everything is prescribed by electronically. So everything is inside, and everything is possible to be checked by the official vets.
Okay, thank you. Still see no yellow hands, or maybe I missed them. I'm asking Katarina and Irene, but I don't think so. If you want to ask a question, and I encourage you to do so, please use a little hand to raise. We go over to another question which has been asked, and this is, well, I think this is a good question for Katarina. Katarina, you told us in your statement that, let's say, the little hurdles, like who has to pay and what is the burden, etc., will be overcome because the let's say the developers of the system will take care of that. But of course, there's cost connected to, let's say, making this to develop this system, but also for, let's say, increased burden for the users. You have to buy software, you have to spend time, etc., etc. I know from the countries where the system already is working that finances has to go hand in hand by developing these kind of monitoring systems. If I would bring the question back to a plane, who should pay for this? Is that something which is possible to answer, or do you have an idea on that, Katarina?
Well, I know what has been done nationally in Finland, and here the choice is that the authorities are developing the system where the vets or their data management systems have to upload the data, and the data collection and other issues, they are not compensated to the vets. And I believe that it is the same thing in other countries also. But like I mentioned, I think it is the most important thing that the app or browser system would be as easy as possible, and that best thing would be if the data upload would be only once. So once you sign the medication, so it would be just once. But I know there is a lot of development has to be done before everything is ready. And I know there is always the beginnings, the more difficult. That's why here in Finland we are starting the data collection already in 2022 in order to make to validate the system and to learn from how to make it better. Thank you.
Okay, thank you. That's a clear answer. So the developing of the system was paid for by the government shortly, but it is made so, let's say, so user-friendly that vets don't have a lot of burden extra for filling in and putting down putting down the information in the database, but it's not being paid for. Hetty, how is this organized in the country where you're based, the Netherlands?
Okay, thank you. I was unmuted. Okay, in the Netherlands, the management system of each vet, so the practice management system, where the data are collected, sending these data forward to one of the sectoral data houses we have, and once a year we pick up these data and do our analysis. So the only thing what the vet has to do is put all the data of the prescriptions in his data management system, and at night these data will be sent to a hub, and from the hub to this sectoral data houses.
And the funding of that, who pays for what?
Who pays for what? Having these data houses, each sector paid for themselves at the beginning to get some funding from the national government, and now they pay for them themselves, and that's paid by the farmers, to be honest. And the time-consuming thing to put in the data into the practice system, this management system in the practice, that's the time it will cost to the vet.
So the part of the database is funded by the farmers.
Yeah,
the different sections, different kinds of animal species, and the burden on the practice, is paid for by the vet. But a lot of vets, I've heard, charge their clients for it.
Okay, that's up to them. So it's if they would like to do that, and they're doing these analysis on a yearly basis. That's partly paid by the livestock sectors and partly paid by our government. That's a 50-50.
Okay, so it is a high private level.
Yeah, it's a high private level in the Netherlands.
Yeah, that's okay. Great. And then another question, which is always coming back in all countries, in all situations, and this is very well to understand. Who owns the data? That's or who should own the data? Because this is different per country, as I know. Maybe we can ask Gregory, who should own the data? What do you think?
Yeah, thank you, Rens. That's indeed a question we have been asking for quite a time now in all those discussions, because we consider as maybe, if not the only owner of the data, we should at least be a co-owner. In reflections, we thought that probably the owner of the animal is definitely considered as the patient to the parallelism to the human medicine, but also the person that generates the data, that creates it and also encodes it, should, in our opinion, should be a co-owner. And so it's always the question what's happening with the data afterwards. And we think we know that those associations that manage those databases, as everybody knows, data is equals money at some point, and so we fear that everybody's trying to get a financial advantage out of the data, except the people that generate it. That's the point.
Clear. I think an important statement. Sorry?
No, just to answer, I don't know who is the real owner, because we never had a clear answer from the authorities about that. So.
Yeah, well, there is some information that this is different per country. In some countries, the vet is the owner, for example, in the Netherlands, but there are other countries where, let's say, the farmer is the owner, or the government just can claim these data for use for purposes of calculating daily dosages. But this is different per country. But of course, should be solved, because we have impressive privacy legislations in the EU since not that long time, and it's an important point, because especially when you can look into databases on a level of a vet or the level of a farm. Well, you don't want to share with everybody, maybe, but we know in some countries this is public. So it's different, but you always have to raise the question, I think. Another one which is important, and I think it was Lucy who made very clear, and for practitioners, this is, I think they will support that statement, that you can do whatever you want, but you have to change, also have a practical effect in the end. And so it's not only about rules. So I would ask Lucy, how can data-driven activities improve areas of activities of veterinarians? For example, if you call it disease prevention, can we find a relation between what we do as a result of this regulation, collecting user data, and then seeing differences in the daily work field of the vet in a positive way, in a beneficial way? Do you want to spend some words on that, Lucy?
Thank you very much, and I can share some experience from Czech Republic with the system, which is already run under the pilot project, and it is for dairy cattle sector. So I have to say that once veterinarians together with farmers started to cooperate and started to fill their, let's say, on-farm statistics, it is not only about collection of the data on antimicrobials, but it is also about collection of data on another veterinary medicinal products. And also they used, for example, the indications to be compared, for which indications they are using a lot of antimicrobials, and also they interconnect it with the stock of their veterinary medicinal product, with the prices of veterinary medicinal product, with the withdrawal period statistics. So the system is more broad. They will pick up only the data announcing use to the national authorities, but the rest of the data they use in their practical everyday life, and they can, let's say, use them really for everyday practice, not only to improve the health of animals, but also to manage their, let's say, prices as for veterinary medicinal product, veterinary care, about handling with diseases, finding the most prioritized indications to be managed on their farms, based also on the amount of antimicrobials used for these indications. So I have to say that on the farm where it works properly, it can be a really powerful tool. And another thing I would like to mention is that I think it is the future, that we should present and communicate our data to the consumers. We should show them that European farms handle with antimicrobials responsibly, and that the food from our farms is very safe. So I think it is also some kind of, let's say, promotion of the good practices, and hopefully it could be returned back to the farmers and veterinarians in some pricing of good quality, high quality food coming from these farms using antimicrobials responsibly. Thank you.
Thank you, Lucy. Does that mean that you make a plea for making this free, accessible, and visible for the general public?
No. It's about at the beginning. This is only among farmers and veterinarians on certain farms. Once you advance, you set in a good way the system, then you can, of course, produce some statistic, some communication towards consumer or public to show that you improve, that you use antimicrobials as less as possible.
Okay, so you start within, let's say, the professional areas. Okay, great. One question, I think it will be the last question, because before we go back to the wrap-up, it's a question again to Giovanni. I'm always happy that a long time ago Giovanni gave me permission only to use the first half part of his first name and forget the rest. Thank you for that, Giovanni. It's a question to you again. How can you see that, is a prescribed medicinal product, is it considered to have been used already? That's a good question, because in sales data, this does not have to be the case. But of course, if you make a prescription, it does not tell that the antimicrobial factually has been used already. Can you give a brief answer to that, Giovanni?
Thanks. We have two different things. If you have only prescription and you assume that this is after a visit, and so you will use as soon as possible for the animal because it is related to a problem, so this is considered as used. But we have also in Italy the possibility to have a small amount of drugs that you can have into the farm. In this case, you need every week to download the amount that you used. You have to report on the paper, and then you have to write that you used. At this moment, you need to communicate to the system that you used, but it's not mandatory where you used. So is I use that product, but you can write the category to help classify to calculate the amount for each category, but you don't have to indicate which animals. So that is on the paper.
If the question is if you deposit a prescription into the database, can I be sure then that antimicrobial has been consumed by the animal? Or can it still be on the farm because of stock or whatever?
I think we can 90% sure that it was used.
Okay, clear. Thank you for that answer. I think we got all the questions. If I forgot some, please, Katarina or Irene, can you give me a sign? I think I don't see any yellow hands. I want to thank you all for asking questions and answering the questions in our panel and our speakers, of course. And if there are no other questions, if you have questions, you still can send them in, as Barbara has explained at the beginning of this session. And for the moment, I'd like to switch back to Barbara for the wrap-up or the final words. Thank you all.
Thank you very much, Rens, and thank you very much to all the speakers, panelists, and participants who asked the interesting questions. The wrap-up is not necessarily easy to do, quite simply because I do this, because it's part of my responsibilities. But I'm grateful to have heard Giovanni today, who explained to me how a well set up national system can help veterinary practitioners and farmers really reflect on how they use antimicrobials and how to use the data to drive for change. And for me, I never believe in collecting data for data's sake. It's really to drive for change, to give us a basis for showing whether we're doing something right or whether we can improve on what we're doing. So I really appreciated your input today. And we hope from our side that you found the session also useful for your day-to-day work. And we encourage you to follow the progress of the agencies and the European network of regulators work. And we will, of course, continue to work with FVE to explain how legislation is relevant for practicing veterinarians in their day-to-day life. And of course, hear from you how we can make our the things that we do more relevant to you. One of the things that Rens mentioned at the beginning was really AMEC. So collecting data on use of antimicrobials is only part of the agency's work, and I really invite veterinarians to have a look at for other information on the agency's website. I believe the AMIC categorization of antimicrobials is a key piece of information that can inform veterinarians when selecting antimicrobials for the animals under their care. So thank you for your active participation today. I hope to see you soon, either in another webinar or hopefully in person at some point in time when we can meet again. And with that, I wish you a wonderful remainder of the day and all the best until we meet again.